What is your definition of success, Lisa?
Being happy and content.
What makes you happy?
Family.
What would you like people to say about you in 100 years from now?
That I cared more than it was wise.
Hi, my name is Dr. Erwin Kwan. I am on a mission to dissect what makes high performers, innovators, and great leaders successful. With this podcast, I aim to share insights from interesting and exciting conversations with people who have figured it out to inspire you and empower you with actionable tips you can put into practice to hopefully improve your life. In today's episode, I have the pleasure of introducing Dr. Lisa Thomas. She's a family doctor with a special interest in lifestyle medicine. She's also a meditation teacher and has a YouTube channel called Revive Prescribe, where she shares guided meditation. It's great to have you on my podcast, Lisa.
Oh, thanks for having me. It's exciting to be here. So thank you for having me on.
I thought it would be interesting to know what's the reason that led you to lifestyle medicine and meditation.
Right. Okay. So when I had my first daughter who's called Tora, she, from about a week old, I suspected that she had a condition called neurofibromatosis. So she came out in what's known as cafe au lait spots. And we don't have any family history, well, not in my family, of this condition. But at a week old, she started coming out in all these coffee-coloured patches. And I just suspected that something wasn't right. My suspicions were confirmed once she had genetic testing, which took about a year in total for her to be diagnosed. We were diagnosed with NF type 1, and she's a spontaneous case, so no one else in the family has this condition. So it completely came out of the blue. So it was a huge shock for me as her mum and for the rest of the family. And obviously, because I'm medical, I sort of knew what the consequences of this genetic disease means for her. And obviously, one of the biggest difficulties with dealing with this diagnosis is how unpredictable it is and how it increases patients' risks of all sorts of medical conditions, including nerve tumours, but also other things like high blood pressure, kidneys disease, diabetes. So anything you can think of, there's a higher risk of it associated with NF1. Obviously, because she was diagnosed with that, as a mum and as a medic, I just went into research mode. So I read pretty much anything and everything on the internet, every journal I could find. I'm probably the most well-read person when it comes to neurofibromatosis. There is no cure, and we're way off that at the moment because it's such a complex genome that finding cures for it is difficult, and it's not coming anytime soon. Although there is very interesting and fascinating research in this condition, a cure is way off. So I had to look at other ways around how I could reduce my daughter's risk of having any other health problem. And I just wanted to do whatever I could to protect her, obviously as her mum. And everything I read boiled down to the same thing. The healthier someone is, the better. So lifestyle makes a huge difference. And it's the same in any other health condition, actually. If you look at NICE guidelines for everything, lifestyle is always a big thing as the plan A when it comes to treatment. So I just started focusing more on that. And the more I read about lifestyle and its impact on health, the more I thought this was really something that we can actually take hold of and really change people's lives with no risk of side effects or that we get with medicines. And I just started looking more into that and then incorporating that into Tora's life, but also the rest of my family, and any of my friends that would listen to me as well. So it's just something that I started to talk about all the time. So we completely changed the way we eat, we completely changed the way we live, and completely changed the way I thought about things. So I became more positive and realized how important mindset is in everything. And the biggest thing that I worried about is how Tora would manage to cope with this condition and how she would feel and how it would affect her self-esteem and confidence going forward in her life. So that became a really big thing that I was worried about, and I really wanted to try and direct her into a good positive way of thinking, which is then where I found meditation. So I'd been doing meditation off and on for years, and every time I'd get stressed or go through difficult patches, then I'd start meditating regularly. And I think, like most people, once things all settle down, it kind of falls down your priority list and other things take over. But when I had this diagnosis, and then later on when Tora was diagnosed with a brain tumour, and I was going through a few other difficult things at the time, I just decided then that meditation was something that I really had to practice every day, and that had to be the most important thing. And having that means that everything else just falls into the right place, because I start off every day with a meditation session, and then my mindset is right for the rest of the day and makes things easier. The more I read into meditation and its benefits to health, the more I then implemented that in Tora's life as well. So that's a big thing of the big lifestyle medicine thing that I use in her life, as well as nutrition and exercise and things.
It's very insightful to see how this diagnosis has been transforming.
Yeah, because although obviously it's very difficult, and some days are more difficult than others to cope with the diagnosis, like any days where we have to go into hospital like today, then it's hard not to feel more negative about it or more afraid or anxious. But most of the time I look back and I think actually this diagnosis has caused a huge positive change in our lives, and I think we are actually, as a family, much more healthy as a result of it. So I think actually it probably reduces now that we've had this diagnosis, it reduces the risk of other types of disease.
It's one of the reasons why, like, many people actually go into lifestyle medicine. They have a personal experience, and this turns into a mission where they want to actually improve their life, and they actually do research and find that going back to basics lifestyle is so much powerful than we actually think as medics, because we traditionally use a lot of pharmaceutical management.
Yeah, definitely. I think every other lifestyle medic I've met has some sort of personal story and a personal journey that has led them to using lifestyle medicine for their own patients. And I certainly think that's true with me, because the more I was focusing on that and the more this became really important for my daughter's health and managing her general health, the more I thought, well, if this is this important for my own daughter, this is what I should be applying to my routine medical practice as well, and I should be informing all my patients that this is the right way to manage their health, and add any pharmaceuticals on top rather than pharmaceuticals being the plan A. And I think the other thing that by doing this lifestyle medicine, it really makes me feel more empowered and less anxious as a mother of a patient. I feel like I'm in a bit more control and doing something, actively doing something positive. And that's what I say to patients as well, is that, I'm not just lecturing them on how to live, it's more giving them the tools so that they feel empowered themselves and that they actually take part in the partnership of their healthcare.
Yeah, that's so true. When you are at the receiving end of care, because as doctor, it's a very difficult experience. How do you find it when you learn about the diagnosis of your daughter Tora having an F, and then when you learn about the diagnosis of a brain tumor?
Yeah, it's really difficult being on the other side. Really, really, really difficult. And I think really difficult as a medic as well, because I think most of the appointments I go in there as a medic often. So I try and put on this front to be strong and, get all the correct information and management plans out. So I tend to put on a front that I'm a medic, but it means then that the team on the other side treat me like a medic, which means that you get the harsh truth that's not washed down at all. So it can be really difficult for them to know how to express things. So particularly with oncology appointments, I've told obviously the oncologist to give it to me straight, and that is how we interact. But it does make it really difficult because it's very medicalized and it's not sugar coated at all. It's hard. It's definitely hard going from medic mode to mum mode. And the only thing that's made me feel better is being able to offer my side of Tora's management, which is the lifestyle medicine, and actually her team, all her consultants, because she's under many specialities, they're all extremely supportive, and they're actually all very interested in how I implement it, and they're really keen to continue that, and they wish that was a bigger thing in the NHS at the moment. So, I feel more of a team with them, because obviously the oncologist can manage the oncology side of things, and I can do my bit, and I'm happy to leave them to do their bit, knowing that that's their expertise. And I can do this bit, that in between her, the month or 2 months in between her hospital appointments, I know that she's having some kind of positive input into her healthcare, that every day something good can help her development and her immune system.
That's great. Can you share a concrete example how lifestyle medicine has changed Tora's life?
It's hard to know how it's changed her life too much, because she was so young. So it was about 12 months. She was about 12 months when she was diagnosed. So we implemented it in her life from really young. Initially, when I first was diagnosed, I read so much into the nutrition side of things, and read a few books that I completely changed her diet and my diet to be fully plant-based. So we were pretty much vegan when it came to food choices, but that became increasingly more difficult to keep up. But we don't eat any meat anymore, and we're pretty much predominantly plant-based. But now and again she gets dairy, because I found it too difficult when it came to school-wise to be a plant-based vegetarian. Essentially, it was a bit too. She was really limited in what she could have for school dinners. So now she does get. I mix in dairy and completely plant-based. So I'd say she's probably 70% completely plant-based, 30% dairy, but they don't have any, my children don't have any meat or anything anymore. So that's probably one of the biggest things that would have changed immediately, is her diet. So we tried to stick to very whole foods, natural foods, and really limit processed foods. So initially I was super strict, and she was extremely healthy. But it meant then that she was missing out on things like party foods with her other friends. And I want this to be a lifestyle that she can stick to, as opposed to a strict diet that she can't then mix in with everyone else. So now I don't give her any, vegan snack food, vegan junk food. To me, all junk food is junk food. So it doesn't make any difference to me if everything's got sugar. Then I don't see the difference if something's got milk in it. For example, she would have like vegan chocolate buttons, but now she just has regular chocolate buttons if she's going to have any of those kind of treat things. But we try and limit that, and I try and educate her about food choices and using food as fuel. So that was a big change to her life, I think, initially, because she was then on really good, healthy, whole foods. The other thing we did, which is probably unusual in a toddler, is use meditation. So she's a toddler that meditates. So that was obviously quite a big change, and I'll try and do that with her most days of the week. We'll try and do either, depends what her mood is like. So sometimes it's 2 minutes, sometimes it's 5 minutes, other times it'll be 15 minutes. So it depends what her concentration is like on the day. But that's something that I try to implement as a regular habit for her. But it's more that every day we try and say things just to build her positive mindset, and for her to realize that everyone's different in society and everyone has different strengths that you may not be able to see, and try and instill in her the skill of using everyone's different strengths, so that everyone works as a team, as a partnership. So that's what I try and tell her to look for in her friends in school, so that they can all work together. And hopefully then that just becomes a normal thing that she kind of looks for in people, and realizes that it doesn't make a difference if you're not very good at running, because someone else can run for you. Do you know what I mean?
It's inspiring how early you're teaching Tora these vital skills that I think every child would benefit.
That's why I'm kind of hoping to do it so early, that this is just how her mindset develops, and how this is just the normal way of her to think. Because I'm hoping then as she gets older that she just has this self-esteem that that she doesn't worry about the stuff that she can't do as well, because she understands that she's got her own strengths elsewhere.
Absolutely. Worrying is a big part of what causes stress, and many people struggle with stress. As a GP yourself, I'm sure you're very aware of the stress problem, and how people respond to stress is actually a big problem because they don't have the tools to manage the stress.
No, and I think stress is something that I think the majority of my patients actually suffer from, whether or not they know it or not. What I find saddest is actually stress now is perceived as something that's quite normal. And unless someone is totally burnt out and right up against the wall, then they're reluctant to admit that they're stressed, because they just think, oh, well, everyone's stressed and this is normal stress. It's certainly something that I try and discuss with patients every day, and I try to warn them that actually stress has got significant risks to health long term, and it should be something that is managed every day, even if you don't feel particularly stressed. It should be something that is I think the preventative approach is really important when it comes to stress and burning out.
Absolutely. Mindfulness and meditation is a good way to actually relieve stress. Could you talk about your experience of meditation, how you actually started meditating?
Yeah, so meditation is my number one thing that I focus on when it comes to lifestyle medicine. So obviously the nutrition side of things, the exercise, the sleep, the good relationships, those are all things that I will approach with patients. But meditation is probably be my area of expertise, really, because I've trained with the British School of Meditation to be a qualified meditation teacher, and I've learned a lot through through that school, and they've really helped me to be able to advise patients on specific ways of using it in healthcare. The reason I initially started is because I was using it personally in order to help me deal with all of my personal stressful situations with Tora's diagnosis, and with obviously having a really stressful job and juggling that, and I was a single mum of Tora and a baby at the time, and being a GP and working out of hours, and it was a lot on my plate, and meditation became the one way that sort of made my plate bigger. That's how I felt, because I couldn't take anything off my plate. So I had to learn to make my plate bigger and my shoulders broader, and meditation really, really helped me. I felt like I had more time. I felt like I had space between my thoughts, and I could really reflect on how I felt about things, and could sort of focus my mind to more positive things. And because it was so effective in my own life, and I felt so much better and totally transformed, really, I felt that was really important for me to share that with my patients, because, at the end of the day, the reason I became a GP is because I love learning about people and how they got ill in the first place and what's led them to that situation. And I really want to give them all the tools that can actually heal them. So, I do feel that my role in society is to help people heal, and support them in healing themselves. And meditation is something that enables people to do that. It's a skill that everyone can learn, that anyone can do anywhere. And it doesn't cost a lot. Well, it can cost no money whatsoever. So working in the Welsh Valleys, where some people are so poor that they don't have trainers to go to the gym, meditation for me is something that I can advise patients do for free, and it's the one health tool that they don't have to pay for, and can actually have huge benefits to both their brain and their bodies, as well as their mental health. I always advise that people try and do it every day, because it's a skill, and the more you practice, the better you'll get, the more effective it's going to be. And most of the scientific research looks at daily practice for around 8 weeks. So I tend to recommend it every day for 8 weeks, and then I'll tend to review patients then, depending on what their condition is and what I've advised. And most advice tends to be to practice it every day, and that's certainly what I do. So I'll always do it every day, sometimes twice a day, depending if I can fit in a second one in the evening. But I'll always start the morning with that, because I believe that mindset is everything, and if you start your day with a good mindset, then everything else falls into place.
I want to ask you, Lisa, about meditation for somebody who's new to meditation and they don't know anything about meditation. How would you approach somebody who needs meditation?
So that tends to be most of my patients. So most of my patients either have never heard of meditation or have very negative connotations when it comes to meditation. They'll either think that it's just for Buddhists or just for vegans or vegetarians, or they can be quite apprehensive. So I always have to remind them that this is not, it's not alternative medicine, it's not being hypnotized, and meditation is a practice that can be for anyone. So it doesn't matter what your lifestyle is. You don't have to be a certain type of person to be a meditator. And to me, meditation is just actually just a normal practice that is natural for human beings to do and have always done over the history of humanity. So, you know, meditation, there's evidence to show that meditation has been recorded back in early caveman days. So there's caveman paintings depicting meditation, and it's found throughout history in many religions. But it doesn't have to be anything to do with religion. So it doesn't have to be just for Buddhist monks, say. So I try and reassure patients to start off with that, you know, this is a health practice that has been scientifically proven to have measurable benefits both on the brain and the physical health as well as mental health. I try and reassure them first and say that it is a practice, and no matter how many times you've tried to do it before, it is different every single time you do it, and it takes practice and it takes being consistent with it. And I try and tell them that it's, you know, it is like playing the piano. You know, you're not going to do it once and then be an expert concert pianist. You have to practice and set yourself that goal of it being part of your routine life, and that it's something that you want to be good at in order to have those benefits. And then I'll usually start off with either a breath awareness practice or a body scan practice. So I try and keep it fairly simple. I try and work with the patients to work out what kind of meditation would suit them, because there's so many different types of meditation. That's the other thing I say to them, is there's loads of different types. So it's about trying different styles and then working out what actually suits you and which one you find easier to stick with. Because, you know, certainly with my practice, it really varies on what type of meditation I do. It just depends on what takes my fancy on that day, usually. So the more you practice all the different types, the more you can work out what type of meditation you want to do that day. You know, a bit like doing sport. You know, some days you'll want to be really competitive with playing tennis, and then the next day you might just want to have a little knockabout. And it's kind of the same with meditation. You can just see how you feel on that day. I try and encourage patients to find either a meditation teacher or a guide that they can follow, because it's really hard to do anything by yourself when you don't know anything about it. And that's why I started the YouTube channel, because I was writing out meditations and practicing them with patients in consultations, which obviously takes time. And then they were asking for them. It's hard to read a meditation. So they were asking me to do videos or CDs for them. And then I thought, so I'll get down with the kids and work out how to use YouTube. And then that's when I started the YouTube channel back in January.
I think your YouTube channel is a great resource for people who want guided meditation, and I've signposted people to use it because it's very, very simple practice, and you have some series where people can start from very beginner's level.
Yeah, so, you know, I always tell them that, you know, it's going to be very difficult to go from 0-minute meditation to 10 or 15 minutes, because invariably people will sit there and feel frustrated for 10 minutes thinking that they're just doing it wrong. So I tell them that, you know, you can start with just 1 minute on day one, and then build up 2 minutes on the second day and 3 minutes on the third day, and build up slowly from there. And most people actually tend to find that they get to 5 minutes or 10 minutes sooner than they think. And then the more you do it, the less of a chore it feels, and the more beneficial, more of the benefits you feel, and then you start to really enjoy it. So then you make more time. You know, that's what I find is the most patients will do 5 minutes, 10 minutes every day, but after a while they end up sitting there for an extra 2 minutes or an extra 3 minutes, and sometimes they're there for 15 minutes, and that just becomes their routine then.
Yeah, absolutely. I think starting very easy and making it something that's not going to take a lot of time is important, just to get this baby step process where they learn to do it and then they start enjoying doing it, and then it becomes a habit.
Yeah, exactly. Yeah, because that's the most important thing when it comes to health, is instilling good, healthy habits. But in order to do that, you have to break down any negative barriers that someone may have in the first place, and trying to make it simple and enjoyable and something that everyone can try, no matter who they are. And that's what I try and do with the YouTube channel, is just try and keep it really simple and really real, and just show that this is how I do it in my own busy lifestyle, and I'm just a normal person like everyone else, and I've got a million and one things to juggle and a huge to-do list that seems never ending. But I try and just put this as the priority, in order to make sure that I'm there for my family.
What's very ironical is people who say they don't have time to meditate are the one who'd benefit the most with meditation.
Yeah. Well, that's what they always say, isn't it? If try meditating for 10 minutes unless you don't have time, and then you should be doing it for an hour. So yeah, that's the one thing. If people say to me they don't have time, then I will usually point out the fact that they've got 24 hours in a day, and they have the same 24 hours that I do, and I work full time, and I've got children and a house to run and endless laundry, and an endless admin task to do. So we've all got the same time. It's just about prioritizing and managing the time. And actually, most people who meditate regularly find that they find more time in the day, and that's certainly what's happened with me. Now that I meditate regular, I'm always ahead of schedule. I'm always ahead of time, and I think that's because my thinking time is so quick now that I'm just efficient in everything I do, and that's what gives me more time. I'm more productive.
Could you share the benefits of meditation scientifically? Because there's a lot of research about how meditation actually shapes the brain, and there's been studies on functional MRI and how it actually changed the neural pathway.
The research when it comes to meditation is fantastic and really, really exciting, and we're getting more and more better trials, better quality evidence coming out to support its practice, and the neuroscience studies are really fascinating. So, as you said, functional MRIs show that there is better emotional regulation with reduced amygdala reactivity seen on MRIs. So it shows that people can develop that emotional regulation, so they don't react so instinctive. They've got time to think through how they'll react, and they don't get as anxious. Then if your fear center in the brain is reduced, then you're not going to have such stressful reactions to things. More reactions in the executive function part of the brain, and in the memory zones. Obviously, there's a lot of talk about neuroplasticity, so the development of new neurons in the brain in response to experience, and meditation develops that. So we see, like, numerous studies show that the structure of the brain has changed, with blood flow being enhanced to areas of the brain that is responsible for executive function. That's really good for conditions such as dementia, or any condition that is associated with brain atrophy, because it slows that. So it's really exciting when it comes to its effect on the brain, but there's actually lots of benefits for the body as well, and the area that I particularly like is its effect on telomeres. So telomeres obviously protect our chromosomes and our DNA, and what we find is that the telomerase enzyme, which is what protects these telomeres, that they are more active with people who meditate. So it just means that you have improved cell longevity, and you have increased health span, so you're less likely to get disease so early. And that's the bit I really like. So Elizabeth Blackburn, who won a Nobel Prize, she's done research into meditation and its effect on these telomeres and the telomerase enzyme. And that's one of the bits that I particularly find fascinating, particularly because, as she says, if you meditate, your skin doesn't look so old and haggard and That's obviously one of the things I don't want. I want to look young for as long as possible, so I try and meditate more.
That's fascinating.
I mean, I think most people will notice that, won't they? Like most people say, "Oh, yeah, if you're stressed, you will look tired and old and haggard," and that's kind of something that everyone kind of knows. And now we've got the science to back up the fact that, yeah, if you're stressed, your telomeres, which protect your DNA, they get shorter, and then your cells will age quicker. So yes, you will look older. And if you meditate and you feel less stressed, even if you feel less stressed about a stressful situation, then your cells will live longer and stay healthier for longer. So we've got research to back that up now.
Yeah, that's great. We've got research to actually share with people who are not too sure about meditation. And I was one of these people before I learned to meditate 5 years ago. If somebody would talk about meditation to me, I would probably vomit. But now my perception of meditation has changed completely. Most people are functioning at high level, very successful. They meditate first thing in the morning.
Well, I think that's the reason why so many of these big successful companies are now trying to implement it in their staff, because so many of the most successful people on the planet do this practice as routine, and it can't be for no particular reason that these people are doing it. Companies like Google and Apple are all kind of implementing it now, and it does make people more productive. It makes people happier. It makes people less stressed, which means that they can work efficiently. Not necessarily, and it give them the right to tell their staff to work harder for longer hours, but it just means that they work happier and more productive in the same time frame and less likely to get ill. So that's the other thing, is keeping your staff happy and healthy is really important for a successful business. I think the evidence when it comes to physical health is endless. It's good for heart disease, it's good for diabetes, it's good for weight problems, it's good in chronic pain conditions and in cancer patients. So it can really benefit anyone, and I think there's space for it in all health problems.
I want to ask you, Lisa, when you started meditating, what are the things that you learn with experience? Because many people, what they find that when they meditate is that they try to control their thoughts. The idea of meditation is not to control your thoughts, it's actually to let go.
A lot of people think that meditation is about having a blank mind with no thoughts whatsoever. Human beings have up to 60,000 thoughts a day, or between 60,000 and 85,000 thoughts a day, and it's going to be really hard to find 10 minutes where you've got nothing going through your brain. So the idea is not to have no thoughts go through your brain, but the idea is to be separate from your thoughts, so that you're not taken off on a tangent with your thoughts. So I will still get thoughts coming through my mind, but they're not ones that I really notice, or I feel a definite separation from them. So they're just kind of passing by. Say if you're sat with your friend in your living room on the couch and you're having a conversation with them and the TV is on in the background, and you kind of know that the TV's there and you can sort of hear it, but you don't focus on it and it doesn't distract you from your conversation. And that's a bit like meditation. So you're focused on your meditation and your thoughts are just kind of background noise that you don't really worry about. And that's the goal, really. It doesn't really matter if a thought comes, if your to-do list pops into your mind and for 30 seconds you're listing your to-do list, then the art is to notice that, and then in that moment where you've noticed it, that's when you're truly mindful, because you know what you're doing, you realize what you're doing, and then you can bring yourself back to focusing on your breath or focusing on an area of your body, anything that just gets you away from that trail of thought. And then when you do that, that's you practicing being really mindful.
I know you use candle when you meditate. It does help to actually amplify the use of focusing on the breath, because when you're breathing through your nose, you have this smell of the candle. That might help.
Yeah, so anything that can bring your attention. So I won't use candles every time, but they're kind of there, and sometimes I'll switch them on, sometimes I would. At the start I would always use them, so I'd always put them on, just because that would help me get into the zone. So it would help me just set up my practice and set up my routine. Now, because I meditate so much, I can flip in and out of a meditation zone so quickly. I can go in and out of a meditative state from 50 miles an hour to meditative state really quickly, because I'm so well practiced. But at the start, I would just set a routine, so I would stick to it every day, and then it becomes easier with practice. But candles really help to make people feel relaxed, and also having that flame there helps focus their energy, I think. And most people just feel a lot calmer when they look at flames. So anything that helps you get into a routine is good, I think.
What type of meditation do you practice, Lisa?
It really varies. So I don't tend to do much guided meditation anymore. Most of mine tend to be silent meditations now, because I just find it easier. Because otherwise, when I'm listening to someone, I just feel really focused on what they're saying, as opposed to getting into a meditative state. So now most of mine I tend to go to my, depends where I am, but my morning ones tend to be where I just go to my floor cushion, and I sit there in front of the window, or with the door open. And then I'll just be in silence for 10 minutes, 15 minutes, 20 minutes, depends on how long I've got before the kids wake up. And I will tend to focus on my breath for a while, or sometimes I will count backwards from 10, and just focus inward. That's what I tend to say to myself, is just to focus inward. And then I tend to, I don't know what happens then. I just seem to go blank and just get into a really enjoyable, relaxed state. And, now and again, you get cool experiences where you feel like you're floating or disappearing into a different dimension. All of those things kind of happen with really experienced practices. But it really varies. Depends how stressed I am, So ones where I'm closer to Tora's hospital appointments or her brain scan, then I know I'm feeling more anxious, so then I take it way back to basic then, and I will do body scan meditations or breath awareness meditations, just to calm things down and release, get rid of all those stress chemicals that I know are being released, whether or not I feel particularly stressed or not. And other ones I really enjoy doing are positive affirmation ones. So I like all the positive ones where you just repeat positive statements to yourself. Or ones where you try and focus on goal setting or affirmations. I tend to enjoy those ones. Those ones tend to give me a lot of energy.
Yeah, affirmation are very powerful tools that actually helps. I've been doing that for a couple of years now, and it really makes a difference in the long term when you do it repeatedly.
Mm-hmm. Yeah. Well, I think that's why my career has developed so much. And I feel confident enough to do that because I focus on positive affirmations. And, when you tell yourself that opportunities are endless, then opportunities do become endless, and you meet more people who are also on the same wavelength, and opportunities that you'd never ever thought of before get presented to you. Like this podcast, like I never thought about doing this. And now, because I do so much affirmations about meeting new and interesting people and developing healthcare and trying to get the message, promote the message of lifestyle medicine out, I get to, meet people like you.
Absolutely, yeah. I'm so glad you're taking the time to make this interview. So the other thing is about visualization. You talk about that on your website.
So visualization meditations, I think, are a really good way of getting people into meditation, because I often find that patients find them easier than the breath awareness ones, because you get to focus on a story and follow and use your mind's eye and your imagination. So I find that patients relax a lot quicker using those. And there's lots of research to show the power of visualization. So the power of the mind when it comes to using visualizations is fascinating. There's a really good book by Dr. David Hamilton called How Your Mind Can Heal Your Body, and he talks about the power of visualization and how to use that for healing purposes. So he talks about how you can imagine, for example, one of his visualization meditations is if you have got a disease, you would imagine that say piranhas are swimming around your bloodstream, and then they're going to find the disease, and they eat the diseased cells to get rid of them. And then you imagine this story over and over again of how your blood becomes cleaner after these piranhas have eaten all these disease cells. And he's got lots of patients who find that really helpful and feel like they're doing something really proactive to help with their own healing. And he's got lots of obviously stories from patients about how they have managed to have miraculous results just by using those techniques. And he's got lots of different visualizations to practice when it comes to healing and particular conditions. But I like the ones like if patients have got palpitations, say, and they get really worked up and anxious because of their palpitations, I get them to imagine, when they get the palpitations, get them to imagine a big drum and focus on a drum being the palpitations, and then dropping a really heavy, big, thick blanket over the drum. Just slowly breathe and slowly imagine a big, heavy blanket dampening down the palpitations and dampening down the drum. And they will often find that doing that helps reduce the palpitations really quickly, particularly with regular practice. So it's little things like that you can just try and use your brain's power to help relax the body, because at the end of the day, the brain is a big computer that controls everything. So why not try and learn how to run it? That's how I sort of feel about it.
That's very interesting. I've never heard of that practice before, but I'm sure that it must have benefit a lot of your patients.
I mean, obviously, when I first meet a patient, I don't mention to them about the piranhas on day one, otherwise they won't come back and see me and they'll just think I'm some kind of loony doctor. But it's just little things that, when I get to know patients, then we can try and optimize their meditations to something that works for them. It's about building a story that they feel comfortable with, actually, and that they are happy to repeat to themselves over and over again. So not everyone will go for the piranha one, obviously.
Yeah, I think it's important to highlight that meditation, and there are different ways of meditation, and some people get put off because they've tried an app and they didn't find it working for them, so they've just shut meditation as an option.
Yeah. Well, that I've had patients before say, "Oh, I've tried meditation before and it doesn't work for me." But meditation works for everyone if you're doing it right and if you learn how to do it right. And there's different types of meditation, so it's important to try. Usually when people say, "Oh, I've tried it before and it didn't work," they haven't tried all the meditations, and they certainly didn't try it every day for 8 weeks before then deciding that it wasn't a skill that they could have. There's no reason why anyone couldn't learn to do it, but it just takes practice. It takes practice and a teacher, and if you had those things, then everyone would succeed at it.
Would you have any particular advice for people who suffer with post-traumatic stress disorder when it comes to meditation, Lisa?
The biggest thing I think that helps with PTSD is learning how to be mindful. So what I tend to say with some of my patients with PTSD is, particularly if they really suffer with nightmares in the middle of the night, is that they develop this huge fear when it comes to their bed, and that they associate their bed then with a fearful place. So trying to change that up is really important. So obviously we do a lot on sleep hygiene beforehand, so get rid of all blue lights and technology stuff beforehand, and I tend to get them just to read a completely different book, just like a normal book, as opposed to like a Kindle or an iPad. Get them to have a really hot bath, and wait in their living room read in their living room until they feel really, really drowsy. Then go into bed, and if they're awake in bed, get them to come out again and read the book on the sofa until they're drowsy again, then go back, so that they're not lying in bed awake, and that their brain doesn't associate the bed with being awake for long periods of time. And then what I try and do is advise them to get like a little bag with a few things, maybe 5 things that will help them to get back into the present moment, because that's the most important thing with PTSD, is that they can get carried away into these horrific memories, and they lose sight of where they are in that present moment, and remind them that they are safe where they are now. So I will tell them to maybe get a picture of someone that they really love, so that when they look at that picture, they will feel feelings of love and compassion. And that's a really good way of getting instantly de-stressed, because love and compassion is the opposite feeling of stress. So most people will say that relaxation is the opposite of stress, but that's not true. The opposite of stress is love and compassion. Relaxation is just the absence of stress, but love and compassion is the opposite feeling of stress. It releases totally different hormones in the body. So if they get a picture or a photograph of people they love, then that makes them feel really compassionate and makes them filled with love. So they instantly release feel-good hormones like oxytocin. So they get reduced stress reaction inside the body. Then I will get them to maybe get a scent or something that they can smell. So that brings them back to the present moment and away from a painful memory. And I get them to put a small mirror in a bag, so that if they wake up in the middle of the night having a nightmare, they can look in the mirror and remind themselves of where they are. I'll also tell them to get like a raisin or a chocolate or something that they can put in their mouth that also engages a different sense to bring them back into the present moment as well. So it's little things like that, or music, anything that helps to get their brain to focus on where they are at the time, and gets them away from the painful memory. And a lot of patients find that really effective. And when they leave that kind of little bag full of those things next to their bedside, over time, they relax a bit more then, knowing that they've got these tools right there to help them if they do wake up in the middle of the night and they're really fearful that they're on their own, that they've got that backup.
There's a lot of things about mindfulness where the thoughts are either in the future or in the past, because when we do mindfulness, we try to stay in the present moment, which is something that many of us struggle.
Yeah, I mean, that is a skill in itself that will only come with regular practice, and regular practice means several times every day. The art is bringing in mindfulness into everyday tasks. So I'll always encourage, say, all of my patients with weight problems to bring mindfulness to their eating. So they spend time being really mindful when they're cooking, and it's all about engaging all of your senses. So you look at what your food looks like, you appreciate what you've got, you feel grateful for the food that you've got access to, and you look at the colors and you smell the aromas and you taste all the different flavors and you feel all the different textures, and you spend time appreciating that. And that is the art of being really mindful, and that will avoid any, say, overeating or stress eating if people are really conscious of what they're doing around food times. So eating is always a good way of practicing mindfulness, because we eat regularly throughout the day. So trying to get people to be mindful every time they eat means they'll get better at that skill. And then you can apply it to other things. So you can apply it to when you're going for a walk, or when you're going to meet friends. You can, tell yourself before you get there that, this is the time to spend time, appreciate my friends, because later on I can get back to my admin tasks. But now this person is worthy of my full attention. And that builds up really good relationships over time then.
Being able to incorporate mindfulness in your daily activity that you would do anyway is a great tip. I know that you have been involved in cooking workshop with patients. Could you tell us more about that?
Yeah, so I started lifestyle medicine workshops then with my patients in the Welsh Valleys, and I linked up with the Happy Project, which is a community project in the Valleys, as well as another company called Cook Together Wales, and then together, what we did was make personal training sessions available. So we do 20 minutes to half an hour of low intensity exercise, things like chair exercise or chair yoga. And then we'd have a healthy cooking lesson with a chef who taught the patients how to cook and how to cook healthy on a budget, and we did things like beat the takeaway. So how to make a really healthy curry or a really healthy Chinese. And he'd also teach them how to make really healthy breakfasts and really healthy packed lunches. And all the patients then had their own cooking station, so they could all cook themselves and then take all the food home with them. And then I do a guided meditation with them at the end, as well as sort of do sort of little nuggets of information about lifestyle medicine and how it improves health and wellness. And then we meet every week then. Yeah, it's been really, really fun because it's been a really good, different way of interacting with my patients and a good way to build a sense of community. The patients have made some new friends together. And it's just been really fun, I think. I just find it really fun. And I just wanted to do more and more of those. So that's what I'm trying to build now, is more of a lifestyle medicine clinic down in Cardiff as well.
That's great. Yeah, I think there's a movement, and patients are very receptive to these initiatives because they're aware that they need to be more conscious of their health, and these things that they do will change their healthy habits, and there need to be more doctors doing it.
Yeah. Well, the patients love it. The feedback I get from patients is that they really enjoy it, and that they really enjoy and love this this type of medicine. And I think it's because they really feel cared for, because, I do actually take an interest in how they live and, how they've developed whatever health problem they have. So I take an interest in them as a person. I don't look at them just as a patient. I look at them as a person, and I try to help them as a person. I try and help them the person that they are, as opposed to just looking at a textbook of, oh, well, this is how we manage high blood pressure according to this textbook. I try and manage the conditions in how they present in that person.
That's interesting. Yeah, I want to shift gear here. I want to talk about well-being and how you actually juggle all these busy activities as a mom and GP, and you're also having your YouTube channel with your new website, which recently launched, Revive Prescribe. How are you managing all this, Lisa?
I know this is what people always ask me, is how do I manage to work? Because I only take Fridays off, but I work every other day of the week. And we've got 3 children in this household. Yeah, I'm a GP, which is really busy, and I've just launched this website. So I've written all of that. I'm doing this YouTube channel. I'm trying to build up an Instagram account as well, to use that as health promotion, as well as set up a lifestyle medicine clinic in Cardiff and these new health retreats called Revive Retreats. So yeah, I do have a lot on my plate, but my secret is no secret. My secret is meditation, because meditation just gives me more time. I do feel like I am the master of my time now, and my plate is bigger, so I can manage to do everything. Sometimes I look and think, well, how did I manage to do all of that today? But maybe if someone came in and saw how much ironing I've still got to do, they think, well, she's not managing that well. But I'm just enjoying everything, and I'm just taking all these opportunities and just exploring them as much as possible, and just really enjoying what I'm doing. And I just really enjoy medicine at the moment. Before I was really close to just getting burnt out by medicine, and started to lose my enthusiasm for it. But lifestyle medicine has really rekindled that for me, and now I absolutely love medicine, and I love my patients, and I really just enjoy work. And I think that is because I practice the type of medicine that I really enjoy. So I still obviously prescribe medicine. I still use pharmaceuticals. So I'm not anti-medicine. I'm just pro empowering patients to improve their own health, and I'm pro prevention and cure. And that's where I think lifestyle medicine really works, is that it helps to reverse things, it helps to cure things, and it helps to prevent things. And that makes it far more enjoyable for me as a doctor, and as someone who feels that their job in life is to help heal people.
Yeah, I think when you do meditate, you actually create a pause between stimulus and your response. So you have a bigger picture, and you can see yourself as a third person observing what's happening, and you get a different perspective of the situation that you wouldn't get.
Yeah, exactly. Yeah, I can rise above things, and then we'll realize what I can and can't do, and what to worry about and what not to worry about. And you get that self-belief, I think, and that confidence that everything works out. Everything will work out. So don't worry about it. Just stay focused and happy, and continue on the mission, and everything works out.
What's your long-term goal, Lisa?
Well, I often talk to people about my mission of trying to get Wales much healthier. So that's one of my big goals, is health promotion in Wales. I think in Wales we have really terrible statistics when it comes to chronic disease and lifestyle related disease. So I'd love to have a big impact in health promotion in Wales and using lifestyle medicine in Wales, because I really think it is the answer to the Welsh NHS problems. I think this is something that is really affordable and should be implemented in the NHS, and I think it will make a huge impact to the well-being of the nation. So that's one of my big missions. But really, it's to try and spread the message about meditation and how, you know, this can be just for normal everyday people. You don't have to be a Buddhist monk or a vegan. You know, anyone can do this, and it suits anyone of any lifestyle. I really want to be someone who can help people to learn and develop that skill so that they become empowered by it, like I have. And I've benefited from it so much that I really want other people to as well. And, you know, I think one of the big things is that people change through desperation or inspiration. And I had to change because of desperation, but I'd love for other people to change because of inspiration and not have to go through the desperation that I did.
That's incredible. I want to ask you about the retreat. How did you get the idea to start this retreat?
So it came to me it came to me in a meditation where this idea came where I thought, I could spend a weekend with patients, teaching them all about lifestyle medicine, and then I could actually do meditation with them twice a day, and they would have to listen to me then, because there's no getting away from me, because I'm with them all weekend. And then while I was talking to this guy who does my nails, he was telling me how, you should do a retreat or something, and you should spend time with your patients, and then you can tell them all about meditation and your lifestyle medicine idea. And I said to him, oh my God, well, I can't believe you just mentioned that, because this morning in a meditation, I decided that should be something I try and do. So he was really encouraging and said I should definitely do it. And then a couple of days later, a friend messaged me to say, you need to meet this girl called Karen. She's a health and life coach and a personal trainer, and you two would get on because you talk about the same things. So I met her, and we're literally on exactly the same path in life. We're both go-getters who both have the same mission to try and help as many people as possible get healthy and fit and happy. And I was talking to her, and she basically wants the same things as me. So we decided to link up and set up these retreats together. So I'll do these medical consultations and blood testing and examinations in order to try and prevent or reverse chronic disease. And she will do life coaching and health coaching and the movement sessions. And we've now linked up with a chef who believes that food can be used as medicine, and that food is to nourish and fuel the body. So he's the perfect guy for us to link up with. So the three of us are going to offer these retreats where we will give and empower all our guests with the tools they need for a happy, healthy life.
This sounds like an exciting recharge retreat.
Yeah, we're really excited about it, and our venue is incredible. I think just being in this venue is enough to make people feel happier and healthier, because it certainly does certainly did when I went there.
That's great. I want to ask you, Lisa, what bad advice do you hear commonly in your field?
I've heard people say that lifestyle medicine is not real medicine, that this is not a GP problem, not a doctor problem, this is a public health problem, that lifestyle medicine should be just the government's problem and nothing to do with medicine. So those are the worst things I've heard. And obviously I disagree with all of that, because I think as a doctor, your responsibility in life is to advise patients on how to get healthy, and advising them on the things that they should be eating or avoiding, and advising them on moving and sleeping and having good relationships and avoiding stress. These are all things that have a serious impact on health, and it's our job and responsibility to be able to advise patients about that and about the evidence that backs that. I sort of hate the mindset of passing the buck to everyone. I think that's the problem with society now, is everyone blames everyone else, whereas I think we should collectively all work together as a society to all have responsibility to get the society as a whole healthier and happier, because the happier, the healthier everyone is, the better it is for everyone. We'll all benefit from that.
Absolutely, yeah. As doctors, health promotion is something that we commonly do in general practice, and we may be saving life in slow motion or silently, but it's very powerful when doctors actually give this advice and believe in them.
Exactly, yeah. Well, I always think general practice is basically like being a seatbelt. It might not be as sexy a job as being a plastic surgeon or a cardiothoracic surgeon, but over time, the little of a seatbelt saves more lives, doesn't it? So that's the way I like to look at general practice.
Yeah, that's an interesting way to look at it. It is actually a lot of prevention that we have to do, yeah.
Yeah, exactly.
I want to shift gear now. Let's go in the rapid fire question. I'll ask you a question and you tell me the first thing that pops in your mind.
Mm-hmm.
What is your definition of success, Lisa?
Being happy and content.
What makes you happy?
Family.
What would you like people to say about you in 100 years from now?
That I cared more than it was wise.
Name one person who has helped you in your career.
My fiance Ian, even though he's not medical, but he is my rock.
Have you dealt with what seemed to be a crisis at the time, which later turned out to be a blessing in disguise?
Yes, my daughter's diagnosis of NF1 and her brain tumor.
So before we wrap up, I want to ask you, Lisa, what are the 3 things you want our listeners to take from this interview? 3 advice before we part.
So my number 1 advice is that meditation is for you. Whoever you are, meditation will benefit you. Just stick to it and trust in the process, and you will feel benefits. No matter where you get your whichever resource you use for your meditation, you will benefit. It will benefit anyone who sticks to it. Medics, I implore all medics to find out more about lifestyle medicine and to try to connect to other lifestyle medics, because the lifestyle medics that I've met have been fabulous. They're such good characters. And I've made some great connections all over the UK, and I really feel more of a sense of community in medicine since doing lifestyle medicine. Because before I only kind of knew other Welsh doctors, which is great, but now I feel like I've broadened my community of medic friends. My 3rd piece of advice is for everyone to practice what they preach and to stick to what makes them happy, and to get some self-belief, because anyone is capable of anything if they believe in themselves enough.
Thanks for sharing this free advice to our listeners. Where can our listeners find out more about you?
So I've got a website called reviveprescribed.com, and I'm also on Instagram, so Dr. Revive Meditation. On YouTube, my channel is Revive Prescribed Meditation, so there's free meditation there for people to listen to or to signpost their patients to. On Twitter, I'm Dr. Lifestyle Med, but all the links are on the website. So if you go to reviveprescribed.com, then my social media links are on there.
That's great. Yeah, I highly recommend you check out reviveprescribe.com. There's a lot of good resources on this website. Thank you very much, Lisa.
Thank you. That was fun. Thank you very much.
Thank you so much for listening. I appreciate you taking the time. Now, the obligatory disclaimer. The information shared in this episode is for information purpose only. Please do not use this as medical advice. The advice provided is not intended to be used or replace medical advice or doctor-patient relationship.